great allies in the fight, and we've got to bring those in. And one of those is the actor Mike Farrell. I know all of you have probably seen him, best known for his role in MASH on television, where he played a doctor. He's been an activist. I've worked with Mike a lot through the years on different social, I like go back so many years. But he's been doing this work for so long in terms of human rights. He's been doing probably the most on single payer than anyone in the Hollywood community. He's been pushing and pushing and pushing. He pushes within his own union, the Screen Actors Guild, and he's the first vice president of the guild in LA. So anyway, but he's been a friend, and he's been a friend all the way down the line on human rights, and it's with great honor that I introduce to you actor Mike Farrell.
Thank you. It's an honor to be here. I've heard that song before. It's an honor to be here today. It's an honor to be among you, healthcare professionals who are trying to tell the members of Congress what is actually needed for the patients in this country, what's actually needed for all of us. I want you to know that 30 years ago, I was out in Montana campaigning to get Max Baucus elected to the United States Senate. That was back when he was a Democrat. It's interesting to watch the metamorphosis. Watching the film of him the other day gaveling the Senate Finance Committee hearing to order. You know the scene, a group of healthy, wealthy, well-dressed, powerful, mostly men, sitting and harumphing importantly about an issue. This one was a hearing where stakeholders were invited to discuss the problems facing our healthcare system. I thought it seemed odd that the panel was all insurance company executives, lobbyists, and business types. It didn't include a single payer proponent. Aren't they stakeholders? But the odd quickly became bizarre when a single payer advocate rose from the cheap seats to speak to this august group, only to be quickly escorted out of the seats under armed guard, apparently a threat to order. Then, after his chairmanship gavelled the room to silence and tried to dismiss the single-payer supporter as a crank, another quickly stood to raise the same questions. As she was pulled from the room, yet another rose to speak, and another, and another. Finally, the number that ultimately stood to express their support, only to be escorted out, grew to the point that the chagrined chairman found himself reduced to grimly voicing a fear that there might not be enough police. It occurred to me watching the poor man grind his teeth that perhaps like lepers of old, single-payer proponents should have to wear a bell so he'd know as they approached. During the tumult, with the gavel crashing and the police taking away the unwelcome citizens, someone in the crowd whispered to another, "How many are there?" "Lady," I wanted to shout, "there are millions of us." I thought someone might have become confused watching that tone-deaf display of entrenched power about which country we were in. It's an odd thing to watch those who've been elected to serve the people become so wedded to the levers of power and money that they are somehow able to free themselves of the burden of vision. How is it that the health care of the citizens of this country have become a product, the access to which is determined by numbers crunchers and profiteers? By whose standard is it determined that the poor, the unemployed, and those deemed uninsurable and therefore invisible should suffer in misery and die because they don't fit within the margins of profit? The health of the people in this country, all the people in this country, is a primary part of the wealth of this country. And access to the proper care of that health should be recognized and treated as a fundamental human right. A single-payer system, call it Medicare for all, treats health care as a human right. God bless you for standing up to them.